Hello and welcome to Tea Talks today. My name is Sharon Gill and I'm the head of community engagement at Total Health. Our Tea Talks may look a little bit different today for those of you who usually watch our show because it's always me or Sarah with a guest. But today I wanted to do a brief wrap up of our Seek virtual workshop, which took place on Saturday. And let me just say this, if you are not part of our Seek workshop, if you have never attended, you're missing something out. You're missing out. And so today I wanted to focus on one of the presenters. The presentation was on LGBTQ plus and cancer care. So I'm going to share my screen and just talk about my key takeaways from this weekend. Here we go. Well, first of all, just to reiterate, the Seek Color Certificate program that is put on by Total Health is a diversity, equity, and inclusion accountability initiative that encourages cancer care clinicians to pursue education and resources that help them better serve patients of color. And it's not just patients of color, it's patients of color, it's underrepresented groups, which is where LGBTQ comes in as well. They're not always people of color, obviously. With the mission of ending disparities in care, to overcome the disparities that exist in both cancer care and in life, we not only have to see people for their unique individual experiences, but we must seek them out. That is our belief. We must seek opportunities for inclusion. We must seek education on differences in treatment. We must seek to understand barriers that inhibit access. And that is what our program is all about. And if you attend 3 or 4 virtual workshops, virtual or in-person workshops, you will be certified and your information will be, presented on a searchable map on our website. But it will also show your commitment to diversity, equity, and inclusion as it relates to treatments, to cancer care, to healthcare, to ending disparities. So it's a great opportunity for you as a clinician. All right, so the next slide, which I am borrowing from the presenter, was Dr. Shale Mangy, and she spoke about the unique needs of LGBTQ in cancer patients and survivors. All right, so I highlighted a couple of things that really spoke to me. Screening and early detection for LGBTQ communities look a little bit different from maybe the rest of us, especially trans. They may be excluded from traditional screening campaigns. They may not take place. Their screening may not take place in gender-affirming settings and previously not based on anatomy. Let me just say this. I was listening to a DEI discussion recently, and one of the things that was very challenging for me and for the guests on that particular show was that we all have inherent biases. I don't think anyone is excluded, including myself. And so one of the things that we have to first do is to examine what those biases are. And in the case of the LGBTQ plus communities, I think it's so important that clinicians, folks who are working with this particular group, is to examine yourself and be truthful about your comfort level, because that is going to affect the way how you approach this particular population. One thing that spoke to me especially was in the end of life. The question was asked, are the right people at the bedside? And I thought, what does that mean? And the explanation was that for an LGBTQ person who find themselves in a hospice situation, they're in hospice, and the people at the bedside, or the people who are naturally called in by healthcare workers, are parents. And sometimes there is an estrangement with the patient and the parents, or the patient and family members. And so we have to respect the dignity of the patient. And how are we going to know if we do not ask questions? So we need to ask more questions of this group. This is some research that the doctor had pulled. Why is it important to know your LGBTQ patients? And as you're watching this, why do you care? And why should I care? Well, there are a lot of LGBTQ patients. There are a lot. And they're getting more comfortable, rightfully so, disclosing who they are. But clinicians don't ask. And rarely is this because oncology care providers are overtly discriminating or uncomfortable. It's rarely that. So why don't we ask patients about their LGBTQ identities? Well, we don't know if it's important. We don't know if it's important. So for a clinician, a patient comes to your practice and you're not asking these questions because A, you don't know if it's important. B, you don't know if patients feel safe, comfortable answering that question. C, you don't know how to ask. But what happens because we're not asking these uncomfortable questions, maybe because we may be uncomfortable, right? Is that these patients are not getting proper treatment and it's resulting in terrible outcomes. And we don't understand the experiences of LGBTQ plus patients. To me, if you're in the healthcare world, it is incumbent upon us, upon the healthcare providers, to educate themselves on this population. So education and resources are important. And this is the reason why the Seek Color certificate program exists here at Total Health, because we want to end disparities in care for underrepresented groups. And that includes the LGBTQ plus community. We don't need to keep our LGBTQ plus patients in the closet. Okay, we don't. They have come out of the closet and we don't need to keep them in the closet because invisibility is harmful. Is harmful. People die. Miss opportunities to know our patients and connect with their caregivers. We're missing these opportunities. Again, it may be because we are uncomfortable and it's important that we recognize our inherent biases so that it doesn't become a stumbling block to patient care. Amplify and ignore the high levels of discomfort and mistrust. It results in the results of minority stress. You know, one of the things that was pointed out too is the intersectionality of LGBTQ patients with other minority groups. So LGBTQ plus, Black, or plus Hispanic. So it's almost like there's double or triple things going against you. There are just implicit bias and there are assumptions. And this results in missed opportunities to provide equitable cancer care. And we're talking about cancer on our show, but this is for honestly, any healthcare. Our particular mission is in oncology, but this is for any healthcare. So what can we do? Well, we can listen, we can understand, we can advocate, we can ask open-ended questions, right? We can, again, go back to, we can address our implicit bias. There are many resources out there if we care to learn. This was a resource that was suggested by the presenter. So how do we do this? We need to know how to ask. Know how to ask. Ask your institution to collect this data. Know where the information is in your EMR and use it. Collect it in your research protocols. Familiarize yourself with resources. And again, here was a list of resources that your practice could become familiar with. So the American Society of Clinical Oncology, Caring for LGBTQ Individuals, and so on. National LGBTQ Cancer Network. So again, it's really up to you. And the word that I've been using since Saturday was, we have to be intentional. We have to be intentional in providing care for these disparate groups. Partner locally and create your own resource. One of the key takeaways from Saturday was when one of the questions that were asked was, how does a small practice handle all of these, DEI issues? How do they manage all these differences, and how do they address the disparities in care? And one of the things that we mentioned was create your own resources, engage with your local community, find out, who in your community are already working with the group, with that particular patient group, and collaborate with them, partner with them, create your own resources, partner locally. Survivorship education, their support groups, bereavement groups, welcoming literature, publicly show support for local LGBTQ plus communities. So make also in your materials, are they sensitive to the LGBTQ communities? Is there anything in your practice that addresses this group? And finally, there are 17 harmful bills have passed into law this year impacted LGBTQ and access to healthcare. Know these things. 2 bills have been vetoed and await potential veto overrides. There are 7 anti-LGBTQ laws are pending action and are likely to become law very soon. And there are 400 plus laws being drafted. This is not a political conversation. This is a healthcare conversation, because LGBTQ patients are showing up in your practice. And unless we open our eyes, we're going to continue to see, people dying when they shouldn't. And as medical practitioners, really, that's not what it's all about. It's about saving lives. So educate yourself, get comfortable asking uncomfortable questions, open your mind, address your own personal biases, and so that we can save lives. Thank you so much for watching our Tea Talk today. Take care.